Why are drive TB treatment regimens so prolonged? Imagine fighting an invisible enemy that can hide inside your body for months or even years. That's what makes treating drug-resistant tuberculosis so challenging and why the treatment lasts so long. The bacteria responsible, called Mycobacterium tuberculosis, can go into a dormant state where they stop dividing. When bacteria are dormant, most antibiotics become less effective because they target bacteria that are actively growing. To make sure all these hidden bacteria are eliminated, treatment needs to continue for many months, often up to 18 or even 24 months. Another reason is that patients with drug-resistant tuberculosis usually have a high number of bacteria in their bodies. The larger the bacterial population, the more likely some bacteria will temporarily resist drugs without being truly resistant. This phenotypic resistance means the bacteria can survive despite the medication, so doctors need to keep treatment going longer to ensure these bacteria are killed off completely. Drug-resistant strains are resistant to first-line medications, which are usually the easiest and quickest to treat. To combat this, doctors use second-line drugs, which are often less effective, more toxic, and requiring careful management. Because these drugs may not work as well and can cause side effects, treatment involves multiple drugs at once to prevent the bacteria from developing further resistance. This combination approach makes the treatment more complex and longer in duration. Shortening treatment risks leaving some bacteria alive, which can cause the disease to come back or lead to even more resistant strains. That's why health authorities recommend prolonged therapy to make sure every bacteria is eradicated, reducing the chance of relapse. The side effects from these drugs can be tough, including nausea, hearing loss, or nerve damage, which can make patients hesitant or unable to stick with the full course. Extended treatment also requires close monitoring, including regular sputum tests to check if the bacteria are gone. If bacteria are still present after several months, treatment might need to be extended even further. Healthcare delivery adds another layer of complexity. Many programs use directly observed therapy, where health workers watch patients take their medication daily. This ensures adherence but can be difficult over many months, especially in resource-limited settings. The combination of bacteria's ability to hide in dormant states, resistance to drugs, side effects, and logistical challenges all contribute to the long duration of treatment. In essence, treating drug-resistant tuberculosis takes time because it's about making sure every last bacteria is gone, including those that are hiding or resistant. It's a careful, prolonged process designed to prevent relapse and further resistance. Always remember, if you or someone you know is undergoing treatment, it's essential to follow medical advice closely and consult healthcare professionals for personalized care.